and good morning. This is now Sweet Talk Radio 98.5 FM, and also I go on for welcome to the Good Morning Show when you can tune on each and every day, Monday to Friday, on this medium Sweet Talk Radio 98.5 FM, and also you watch live on Facebook page at Sweet Talk FM. I want to apologize because we started very late this morning due to some technical issues. We don't be this up now, and today don't be Tuesday, 29th of October 2024, and most definitely we wrap up the month of October and we say goodbye to October, and this month we don't declare as the breast cancer area month, and for this reason, and inside the studio this morning I get with me Khadija Kone, we're in oncology nurse, and you can tell you definitely from the start of this month how we don't feel like for the pink and all, and how did they before get the awareness and get the awareness concerning breast cancer. Khadija, good morning. Nice to get you inside Twitter Good Morning Show.
Thank you. Good morning, and thank you for getting me here today.
Alright, so far, let me start off the discussion. Take you through throughout the month from the 1st of October and right on to now, just 2 days towards the end of October. I don't feel like for Unana thinking being for help raise the awareness of breast cancer.
Well, thank you for that question. October na a breast cancer awareness month. The whole world they dedicate this October month for sensitize and raise awareness about the dangers of late detection in breast cancer and importance of the early detection, because cancer, when a bobby cancer, now they kill boku woman then a salon, especially in a salon where they talk about cancer case them, the one with they will top them all na breast cancer, and boku na woman them, and people still they die of breast cancer because the awareness no bandili. So now make October months not only think keeping breast cancer foundation they raise awareness. We don't partner with boku organization and institution them, including the Ministry of Health. We join hand there, even with the private hospitals and clinics then, where they raise awareness on breast cancer and sensitize the general public. So this entire month the focus done day on for sensitize intensively on breast cancer. We don't go to schools then, we don't go to marketplaces then, we don't go to deprived communities then, we even go to corporate institutions then, right? We even go upline where we get sponsorship for do that there, of course through partnership of various organizations then, right? Because Think IP nobody do that. But let's tell you something, Think IP Breast Cancer Foundation, not only inside the month of October we they raise awareness on breast cancer, we they also raise awareness even outside of October, every month actually, within our communities, marketplaces, schools there where they choose, or people where they invite where they go there and sensitize and also give free bobby checkup and free bobby training them. Now we can do so. But when our October months with the open platform where boku people them in partnerships and sponsorship where people want do can join hand for fet this sick year. So the activities them boku. Like for example on the 18th we host AMI Expeditionary Healthcare, and this now a private leading clinic. So
what's in that they mean?
Our AMI not just a name, so right okay. Now a former Aspen Medical International, but now AMI Expeditionary Healthcare. So this private clinic or hospital, so where they offer quality service them to the general public, especially the expatriate. We get boku service them where they offer excluding specialties such as gastroenterologists, gynecologists, urologists, them and boku we get also a paramedic. Now the only country this way gets a trained and qualified specialized paramedic where they offer emergency service them and get ambulance them where they available, and we offer aero medical evacuations them when our people then we get sick, we're not able men in this country, they go able fly them out of this country, we go get a proper and better medical attentions them, right? So this clinic or this hospital don't join hand with Thinking Pink. We don't help for sponsor 3 surgeries them, but 3 women we need surgeries, we get lump na the body, we need surgery. They don't sponsor, and they don't sponsor also by for host this event where they call Pink Health Fair. When are one of the popular health fair program them or events where we can host, where they offer Boku health screening service and then back
inside the same month.
Inside the same month, so on the 18th, we they call them Pink Fridays. So we can host them. We they host a free medical checkups them, such as blood pressure, blood sugar level, diabetes. Where they screen for diabetes, and others also screen for hepatitis B, malaria and typhoid. We do bobby checkup and eye checkup. Then they host which we're so grateful of, and we attract over population of over 150. Yes, people then we don't come and benefit from this service. Then we don't sabi book of the health status them, and it really amazing. They continue for sponsor with Soya even through the most popular events. Then we are the mini marathon where we just host this past Saturdays, so where we attract over 1,000 people them. Yes, and it be very successful. And this event, so now we main fundraising event, so where we don't able raise 15 patients, then we get hope for now get them treatments them through the money where we don't raise from this fundraising awareness activities them. So we dey encourage the general public say but woman because throughout the month, like I said, we're gonna schools, we're gonna communities, we're gonna corporate and marketplaces them, and we don't detect over 100 cases them we get bobby sick them, and them cases them they need help. Then when they we no get money, we no able afford then treatments them. So we they help for raise intensive awareness, and also we they raise money them for them when they forget them treatments.
So far throughout this whole month of sensitization and awareness, and waiting actually when not done they expect it don't come to pass.
Well, with the one thing for sure is the awareness they go out there, right? We're so glad for the month of October. Reason being is that we get Boku sponsorships them, we get Boku partnerships them. For example, like this True Talk Radio, we don't able sponsor me, we go able talk na the radio, and this radio can able reach out wide and even on social media page, as you can imagine, at the most popular platform, social media platform, where Boku people go able watch me and get this information and get this awareness. Then things are very, very important and so necessary, because boku times when I can in my clinic, I can get patients where they come, they say, oh, I see you on radio, oh, I see you on TV, I see you on social media, you talk about Bobby, now I touch me Bobby and I notice this lump, and that kind of story then kind use them, it can very be beneficial to boku woman them, and it can help a lot of women them out there, including the man them.
How will they help the man them?
Oh, very much, because man back become aware about the bobby. Man self can get bobby by the bobby cancer, by the way. Not only woman sick dandy. It affects man and woman likewise. It affects the old and the young them, and even the race, the whites and the black them equally. It affects them. So not only one person sick, and it can affect people of different social class them. The poor and the rich back, can get affected.
They choose.
They choose. It just they go no more anyone. So man then why as a man he can benefit, because it also raise awareness to the man, as we both know say man back can love the woman them bobby, so they can help check the woman them bobby for them, right? I can get boku cases that where woman can come to me, they say, oh, na me partner detect them, na me husband detect them, or na me boyfriend detect this lump na me bobby. So they play a very important role.
How are you able for detect them?
Where they simply they palpate and check the bobby.
Alright, so make you come more now to the main thing. Which actually for the one that we don't know, and which actually they cause breast cancer.
Well, both things and the way they cause breast cancer actually, right? For example, you be woman, nine and the number one risk factors as we see woman then can get breast cancer past the man themselves, right? I believe that because we women then we get certain hormones then when I can be breast cancer can feed on, and more especially we get bobby, right? Boku flesh na the bobby. Another thing can be if you get family member where gets bobby cancer, you can be at risk for get bobby. cancer also. And other one can be where they exercise better, where they move body so no more. Now make we can promote and encourage people then from join this with mini marathon. Then we can be a day of a very good activities where people can exercise and they can get network and they can interact with Boku people them all at the same time. Also they raise awareness and help for fight this disease, right? So we encourage people them for exercise. Another one can be where they smoke Boku tobacco cigarettes, and not only smoking, it can be in the form of shisha where they smoke the tobacco, it can be the snuff where they snuff on, and not only the person go they at risk for breast cancer, but also the person where they tin up near and we know they smoke near the smoker where they inhale all the toxin then where the smoker they smoke can be at risk. Also person where they drink boku beer when are the alcohol, so yes, can put person at risk. And number one main risk factors where I believe say I can be in the food where we they eat. You know, I think say any mortal man say where they hold any food na their hand, they for member say if this food na in go lead me to me early grave or na in go help me live long. Because wait till we eat now we be you eat the healthy food, you become healthy. If you eat boku of them processed junk food, boku oil, boku fatty food, boku salt and boku sugar food, all that they can put person at risk for get cancer. Because all that they lower the immune system. The immune system now the person in body where they fat sick, right? And where it don't lower ramen, all them toxin then they can dinner the body, all them bad thing can dinner the body, can help for promotes cancer, and that can put person at high risk for get cancer.
So, I want to know how comes if person they smoke boku or person they drink alcohol enough, we go for make it get breast cancer. How comes?
Well, scientists they don't prove say that they a number one risk factor. If I not to like now the short thing when I can cause cancer when they drink boku beer, alcohol beer, right? So the beer and dandin it no get no nutritional value at whatsoever. In the way they ingest in the body, it can help for prevent the body in normal functioning. Then one, it gets too much carbohydrates then because obviously it come out from them products them, right? It leads to it leads to boku glucose in the body where they call something where they call glucose insulin. I mean insulin resistance, right? Now a medical time way too broad, but I go try me level best for break and down. But again, alcohol back they help for reduce the immune system like I mentioned, and this immune system now we body function where they help for fat sick, where they help for put body in the normal function, right? But if then they don't unbug, so that means say the body know they operates the way it operates. As you can imagine, some people when they check, they know they pay themselves, right? They talk some things that will not make sense, they behave one kind of way we know actually proper or decent na the society or among them comping them. So that means say alcohol no gets no good effects na the body, unfortunately, right? And it can put a healthy person at risk also for get sick. And not only cancer, other sickness like high blood pressure, diabetes, and many other sickness that we can affect the body. So for drink beer or alcohol is not advisable for the general public whatsoever.
Okay, so what of the smoking?
Smoking tobacco, well, the tobacco na a substance. It actually some of them they come up and plant, but actually the one the way they inside cigarette, they get other dangerous and harmful chemicals the way they don't put the where they don't make the cigarette. And if you can even notice the cigarette packets where they buy, they can even put a warning label. They say your health is at risk of cancer if you take them, because scientists don't prove say that they cause cancer for sure. It's very, very common. And even if not inside cigarettes, if na shisha self, you can be at risk, because even they can get some substance their way, like for example in a country when India, they get some substance that when a tobacco actually, right? They process them in a form like where they able to charm them, right? And the country get the highest rate of mouth sickness then, yes, mouth cancer I mean. Now the country we get the most highest where people get mouth and neck cancer, very, very common, very high, and now because of this tobacco ingredient where even you can find inside cigarette smoking, right? So it's very harmful to the body in a point that it help for reduce introduce boku bad toxins then at the body, especially now we, the throats, the lungs them, and Nike are the most leading cause of lung cancer.
So if they make anything there and they write and back say it's dangerous to your health, why do you think say therefore they make now?
Well, I think that because of business and profit making, that is all. To be honest, I think say the manufacturers where they make anything them, they're very well aware of the risk, including the government, the body where they monitor all them bad substances where people they sell. But because now it's something where now like addiction, person will begin it become addicted now like a drug, now a stimulant, right? Where the person they take it become addicted to them, right? And person sometimes they not go able to stop them. You ask person where they smoke, why they smoke, and you not even able to tell you why, how it begin and why it's still they smoke, because that smoke they not can get benefits. Even the alcohol not gets any health benefits them where the person can derive from them. So but it become addicted to them and they still take them more and more, and because people they still demand more, the manufacturers that they produce, because it they make them money, and then the money are the main priority than the health, unfortunately.
So how you able to detect so you don't get breast cancer?
Well, firstly, person need for know what are the signs and symptoms them, right? Because how you gonna know if that breast cancer if you don't know the signs and symptoms? So number one sign now where person get lump na the body. When they say lump, what's not this lump? When a hard mass, where the best description where I can give, or in Creole where they can say na seed leg, it can fiber like patch granates, but they can be different size, but all along they begin small and they grow big. So that make a patient can come to me and if lump with big like a limb, and also that lump don't take over 6 months, right? Not to or not to this BNTM, this lump come na the body. The other thing a pain na the body. I know they talk about that pain where they pay your period. Even after you don't done your period, you still they get that pain at your body. Then in a sign say something is wrong. Okay.
And the body in which part? The breast?
The body. The bobby, sorry sir. And the other thing back can be where the bobby in mots, then at the nipple it make normal bobby mots if a point out like this, but if you make like it they go inside, it can be the one bobby or the two, then they are the problem. The other part back, it can be the shape of the bobby, right? We all know say there are two bobby for fiber like identical twins, right? But if one bobby, let's say there are two bobby in an orange shape, then one bobby make like pear or banana, then they not a good sign. Then the other thing back now the size of the bobby back, right? If woman get big bobby, then one of the bobby just make like it is shrink, it is small, or it can be back the woman get small bobby, then the one bobby they swell, all that they not a good sign. And again the bobby it kinda, if you feel like say it get beaucoup dot hole like jawbone, you know, then they not a good sign. If it gets beaucoup crocro or beaucoup rash, or the bobby kinda it color it change, it can become dark or it can make like a red, all that is not a good sign. And lastly, the bobby emotes the kind water where they pull, right? And we not say belly woman come they can get water where they come or milk where they come on at the bobby. Then they normal. If a woman will not get belly or we not to kumbra can get water where they come on in bobby. But now the color now you for watch. And which kind color be? If you make red color like blood, if you make brown color like with tea and coffee, or if you make like snots, you know, and if you get bad odor, all that is not a good sign, and you for report them as soon as possible, because that means say something is wrong. But fun fact is that boku sickness the way they affect the body, then past 10, right? But the one way 9 they kill, 9 are the cancer, and most of this other sickness then they keep fever like cancer. Right? So now make if anybody notice any problem, they for report them. Belly woman self can get cancer, kumbraba can get bobby cancer. So they for report any change or abnormalities where they detect, or problem where they detect in the bobby, they for report them as soon as possible.
So with that the different stages now of them signs and symptoms there way person gonna say you don't get breast cancer?
Well, sadly for talk say early stage, woman they never see any signs and symptoms. They not gonna notice pain, they not gonna notice any that's difference na the body. Then at the early stage, that if they be catch them that stage, they able get cure of learner like 90 to 100% cure even inside salon na, yeah. But unfortunately then the signs then but notice them, right? So by the time woman begin notice like lump or signs them, it could don't look they get late, but not in all cases then, because anytime we detect any problem like bobby, you for report them, because go know sometimes at early stage is still depend. Actually bobby cancer they get boku stage them, but for simplicity sake I could put and say they fourth stage, right? No, they get stage 1, stage 2, and stage 3 and stage 4. Now with salon we understand say we infrastructure, especially the health sector, in no 2 day perfect, right? Even the cancer treatment we know did yet. Now that's level or stage where you go say you go able men cancer and cure them. Reason being why woman they die. So but with stage 1 and stage 2, if you able detect them during then stage them, you go able get cure and treatment inside salon aya. But if you get to the stage 3 and 4, now then time there is very very necessary for get intensive and proper treatment, or better yet you go overseas where you go able get then treatment then at the area or country we get them full facilities them for able men. Because in general cancer, for all cancer safe, 3 main treatments they needed for simplicity's sake again, right? Number 1 can be for do operation, then a surgery, right? For pull the bobby or pull the lump, right? Number 2 can be for do for give medicine where they call chemotherapy, right? I can call it chemo for short, right? And then chemicals them, so or medicine, they're very very highly toxic, almost not like poison, but this poison can kill cancer in the body, but it can affect the woman body in so many negative way at the same time, right? But they can very effective also, most cases they can effective for kill cancer in the body, and they can get them. And now the only side now this Sierra Leone where big adult person we get cancer can get that kind of treatment at Connaught Hospital, right? The third one are a radiotherapy. Now waiting at this radiotherapy, well I can say a fiber x-ray machine, a fiber but not so exactly, but in 50 times more strong than the x-ray machine in terms of the radiation ray where they release, we go able to target now the part of the body where gets the cancer, for really kill any cancer cell where the doctor, the surgery where the surgeon we're not able to pull them or not able to see with the eye. Because cancer, like I said, they're very very small. They start at a cellular level, then at the cell inside the DNA they now they begin and they grow, and then level then doctor not able to see while they do the operation them where they pull the lump or the bobby. Okay, so that radiotherapy go able to target that side there and kill them right at that stage them, at that cellular level.
So we get all the equipment in there for ensure say we get to smooth cancer surgery.
Well, unfortunately no. Unfortunately we only get specialized surgeons them where they do the operations, and then we get chemotherapy when are like a drugs them where they give inside drip to patients them, or sometimes it can be inside tablets. But unfortunately not only one pharmacy where they provide that, they in a private sector. You can imagine the monopoly where they overcharge the patients, then we can even where the supplies no can it can hinder that patient in treatment, because the second you stop for take let us say the person begin take the chemotherapy, right? Then it kill the cancer cells, right? And cancer is something where they take time for kill, sometimes 6 months, sometimes to a year. Then imagine somebody take 1 week, 1 month off, because person for take this treatment every month where they go at a cost of $100 per treatment, right? So you need for take them every month, right? And
one day every month?
No, one treatment a month.
One treatment a month.
Yes. Okay. But now every month you get for take them. You can imagine we get for take 6 times, 5 times, 10 times. One lady back you take and say 20 times, right? For kill the cancer cell, because mind you, cancer is a very dangerous disease. When I say it's very dangerous, even sometimes the doctors them they even afraid this cancer sick, because some of them can very difficult for kill, especially where it is stage 3 and stage 4. It can very very difficult, because then time they see cancer, they tap one side. It work on the body, and any side it work, it damage that side of the body. So you can imagine it come on one body, it go on the other body. We come on the body, you can imagine the organs where they around the chest area. It go na the lungs, it go na the spine, it go na the liver, it go na the stomach, right? So all this area they can become affected, and when they become affected, they know they able function the way they for able functions. Now it make woman or person can die of cancer because their side and their organs then they damage the organs them, whether them organs then no go able become useful to the body again. Let we say the lungs. If the cancer go na the lungs and damage the lungs, and the lungs we know say now they person they breathe, they blow, and if that side damage, the person go end up for die.
So wetin this mean na salon or for salon people wey dey battle through breast cancer disease, we like we not get the necessary equipment or elements for ensure say we able for cure breast cancer?
Well, WHO and UICC, when are a body where they help for monitor and help promote cancer care and treatment and the whole world, don't pull reports say back in 2020, because that's the recent report where I get, say 9.6 million people don't die of cancer. And they said half of that number of them deaths them happen at the low income country. Reason being is that we not get better infrastructure, we not get better in preventive policies in place, and awareness no can did it so no more better. Now I make people they die of cancer. So that means say we dey at very high risk, not to something for the future, not something where they happen right now, where they see na something where don't happen in the past, and even presently they happen. And we they see people they still die of cancer, and cancer is a very horrible disease where it affect person, especially in the late stage. The suffering can become very sad and terrible, really. So it's very necessary that all man for take action. The government for take action, the ministry for take actions, the doctors for take actions, the individual Sierra Leoneans for take actions, even the ones that oversee. Because for tell you for a fact, Thinking Pink Breast Cancer Foundation, they're in existence for 12 years now. And what did they keep Thinking Pink Foundation where they existing up to now? Now because of collaborative support and collaborative partnership. Then they can make this, we able push the work of awareness raising, sensitization and fundraising go before and help get the people that were affected the help where they need.
So we want to know when at the time duration you mentioned 4 stages then we person get breast cancer from stage 1, stage 2, stage 3. So when at the time division, let's say from stage 1 for go to stage 2, how many days or months or weeks or years you go take for let it go to stage 2? From stage 2 again, how many days or months you go take for go to stage 3 and 4?
Well, bobby cancer is a very cruel disease. Mind you, different type bobby cancer they back. Not bobby cancer, not just one type cancer. Different type. Now make anybody when notice problem at the bobby, they for go to the hospital or clinic for get assessment and check up. For know which kind cancer it be, then a one first, because different kind of cancer can be get different rates of development, right? Where they able progress faster. Okay, let me say one cancer they way they call inflammatory breast cancer. Then the most feared cancer. Personally, for me too, it's not common, but where it happen, we talk about 2 months. We talk about 2 months, even less, the person can survive. Yes, and it can come without warning. You know, time like where it see lump in the body or the body the pain or no, it come without warning. The body they swell, it warm, and the person can be very sick and need immediate treatment. And in most cases, them it can feel like there are other sickness where it can happen to the body. So in that process, if a doctor will not sabi understand the case them and if they treat them like common body sick, then it ignore the fact saying a cancer, the cancer they continue for progress. And what I mean by progress, it they develop, then it is spread to other parts of the body, and it they damage other parts of the body really quick. Okay, and with the black woman them, the studies don't show say we get one of the most aggressive cancer, and from waiting me see, that aggressive cancer can kill the person in 1 year. Yes. I be see them case them, and I be follow up on that case them. Most aggressive breast cancers them when are triple negative. When I don't believe me, when I Google triple negative.
Triple negative.
It means say you no get, well, like I said, some cancers them they feed on certain hormones in the body, right? Let we say the estrogen or progesterone and whatnot, right? But if you say not triple negative, meaning say they know they feed on their hormones them, meaning that they know they survive on the body in own sustenance, right? They survive on their own. They're very aggressive, they grow fast, and they spread fast, and they damage whatever organs where they spread to very, very quickly. Now it make person can die. And from me on experience, because I've been done deal cancer patients and for 10 years, aggressive cancer can kill person in 1 year if the person lucky self.
So also on the other type of cancer we know we can take time.
Well, from what me understand is that other cancer, well, all cancers by the way they kill, and again, mind you, it depends on the individual again, right? If let me say anybody can get cancer, I don't see healthy person get cancer, I don't see sick person get cancer, right? How your body day depends on how soon you go live, or how long you go live, and how soon you go able recover, or how soon the cancer go kill you. If you're not person we not healthy, you already get other sickness that we they monitor you. Let we say like then chronic conditions them, right? Your chances of survival or chances of treatment can be a very much difficult and tricky one as compared to somebody where already they eat healthy, they exercise healthy, and get a better chance for fat cancer, and in can live longer as compared to people that we not healthy at all. Obesity back now the other risk factor where person get fat body can put them at risk of cancer, because with cancer they unblock the body. Other sickness back when they can even become more aggravated. Let we say like hypertension, high blood pressure, diabetes, when I like them sugar sickness, and even other the conditions in like say HIV/AIDS. When a very common one, if person get HIV/AIDS as compared to person we not get HIV/AIDS, the person we get HIV/AIDS now go die quick as compared to person we not get HIV/AIDS. So again, it depends on the person in health status where it gets the sick. That is why it's very, very important for know your health status. Go for regular checkup. Go check for Bobby sick. Among the women, they more especially cervical cancer. Now the other one where they at an increase, unfortunately, but Bobby sick now in the most. If let we say 10 cancer patients can have room for treatments, 7 are Bobby cancer. The remaining 3 can be other cancer then. That's tell we say the severity of the situation where we get at hand na Salon aya. And not a Salon problem only. Globally, you go Liberia, not the same thing. You go Guinea, not the same thing. You go Ghana, Nigeria, you go West, let me say the American, not the same thing. The most common cancer then where affects the woman then are the Bobby. And Boku they die. Unfortunately, African country, when a low income country, when a like a third world, now then deaths them more can happen as compared to the West. Now the West, now let us say like America, the European countries, and people they survive of cancer, they even get stage 3 and 4 cancer, they still live long because they get the treatment, they get access and availability to treatments them. Whereas in places like low income countries them, they can lack of them treatments them.
Alright, so Khadija, we'll go for holiday for now and make you catch your breath small, and we will now go for a break, and we'll come back. We will continue with the discussion. This is not 2 Talk. Good morning, show on 2 Talk Radio 98.5 FM. Two Talk Good Morning Show. It's on Two Talk Radio 98.5 FM, and this one we're going to talk about breast cancer awareness, and definitely we'll say goodbye to the month of breast cancer awareness. And we this morning we still get inside the studio Khadija Conway, an oncology nurse, and also representative from Thinking Pink breast cancer awareness. So far, make a come back to you again, Khadija. The theme for this year say, nobody, no for left behind,
Yes.
for a battle breast cancer awareness. So far, take me through how best knowledgeable for work towards this theme for this year.
Well, the work where they do can speak for itself. We don't dey raise awareness for the past 12 years now. Thinking Pink organization and other well body organization, they don't dey raise awareness on this breast cancer. And the awareness don't dey go there. Now we dey get people that whether they come out Kailang, Kono, all them far side them, you know, because somebody notice say in Bobby the arts, and they can discourage them for get treatment when I like traditional way. And unfortunately, Boko people still they think say we person get bobby cancer now witchcraft or whatnot. I mean the white man them back they can get cancer. You can tell me say now witchcraft? No. So if most people then where they can get treatment that kind way them they can go through the traditional healing way. They can, after we don't find out say in unsuccessful, they can decide for come now na the hospital. And mind you, cancer they in stage, and most cases they can move from stage 1, 2, 3, they can go to stage 4, and by that time they can come at the hospital, it only reach stage 4, unfortunately. Yes, because you know say they can now trust the medical last, unfortunately. So we dey encourage the general public them, we dey still dey raise awareness say bobby cancer is real, but gone are the days when are a death sentence. But people now, even a salon where we don't come early stage and get treatment, they survive and they still there as today we they talk, right? They go about their normal life and business, right? So it's very important for come as soon as possible, right? Because we help them now. Not like 10 years ago, where I begin with this treatment, begin with this awareness raising, better treatments no be there, better proper management no be there, unfortunately. We no be even get this trained and specialized sabi man doctors them or nurses them. We able guide the patients and offer the best treatments we need now in the condition when I like breast cancer. So we dey encourage the general public still for be breast aware, sabi the signs and symptoms them, know how for check the bobby, because the most important thing is for sabi for do you bobby checkup. When they do bobby checkup, now you dey become aware of your bobby. Boku case the way woman they can come say, I just see this big lump, Gigi snow on her last week. No, now because they be negligent of them bobby. They know they watch them bobby, they know they touch them bobby for a very long time. Now I make this lump can grow. Because I know say lump can take some months, even years before it grow big. So now I make it very important a woman for and man self picking, girl picking and boy picking self go to check them bobby every month, right? Because when they check every month, especially woman where they go through a menstrual cycle, right? Bobby they change every month. I see person we get a week month 1 you know get lump in bobby, by month 4 you get lump in bobby. Now that now so quick the bobby they change, so you forgot to check every month.
So how possible for check in bobby all by itself?
Oh, a very simple. They get something where they call breast self exam. This exam you literally no need anything. Now your hand, no more you need, and of course the mirror, right? For able watch. So what a person can do then time them. The technique they for check them bobby. They just touch your bobby anyhow. You need for know how for check them and the best time for check them. So now they check your bobby where you dip on your period. They check them where you dip on you where you want to see your period, right? Then are you mens. The best time for check now 1 week after you mens. Now the best time for check the bobby. And where they check the bobby is very simple. They use your hand, okay, for check them. But first the person need for watch for them signs and symptoms where I mentioned before. And then I like the shape of the bobby, the size, the bobby kanda, the bobby mods, any changes, any difference. If they notice, they for report them. And also they need for reports if anything they notice under the armpits. they for ace their hand over the head for watch under the armpits, right? Now where they check your bobby, let we start with the right bobby corner, my favorite part than there. Where they check the right bobby, you put your right hand over your head like this, then you use the left hand, right, for check the bobby, for press and massage. Press and massage. What do they do now? You they try for investigate if any lump or any pain or any something where thick or hard they inside the bobby where enough for the if you did it, right? So you check all over your bobby, then you come back, you armpit, you feel for any hard lump when I like a seed, you feel for them. Then lastly you quiz the bobby mouth for watch which kind water they commodate, right? Remember I mentioned the bad water them when I like blood, brown water, or like if you make like snot. All that is not a good sign, so you need for report them. And when you check one bobby, you for check the other bobby back. Why? You need for compare, right? If they all two get the same thing, then that means say no to something we're alarming. But you need for always compare, especially the texture, the fullness of the bobby, and if any side of the bobby thick, you need for compare them with the other side. You do the same thing back. You check your bobby, you know, the left bobby with your right hand. You check them, feel under your armpit, and you quiz the bobby mouth. That is all. A very, very simple. I don't think say anybody can get an excuse not for do that day, and a life-saving exercise.
So now for the Monday, now how the Monday they people check their body?
Well, very simple. The same way how I don't demonstrate for the woman in the same way back man.
The Monday in not someone at chest no man gets it.
Yes.
So how
mind you, I get not a 1, 2, 3. I get more than 5 patients then over the years where I don't work when I man them and they get bobby cancer. Yes, man self can get bobby cancer, and they can get the same signs and symptoms like the woman there. Where bobby they swear, they can get lump na the bobby they pull water. Yes, not only chest now bobby they get, but the own bobby in flat, right? Because all that they are in bobby area, so they need for go to be aware and look out for them signs. They need for do the same thing like how the woman can do. They check the bobby, so check the armpit, feel for the nipple, quiz them if anything they commodate. Because I not even believe until I come across a man who get bobby cancer and he get them signs, and he get lump, bobby swell, bobby the pain, right? Bobby the color change, it make red or it can make dark brown, right? And bobby water can come on at the bobby. Yes, for the man them. So it can possible say man self can get bobby cancer, so they need for also go to check themselves. Then now they not can get them period, so they can check any day anytime, right?
Okay.
Yes.
So for the different type of breast cancer way you don't make mention, I can likely make the inflammatory and also one of the most common one where woman then can get more, and for the man they also are the most common one where man then can get.
Wow, the man themselves now, interestingly, they can get like tissues back. They can get small ducts, them fatty tissues that are around the bobby, right? So the cancer mainly can occur around the nipple area, right? Mainly, then are the lump.
For the men.
Yes, the man. For the woman, them according to the textbooks and waiting me the CSF, where I can say a match with the textbooks, them now they call ductal carcinoma. Invasive ductal carcinoma. That's not the cancer where they begin at the rope where they connect to that side where the milk they manufacture na the bobby to the nipple. That rope where they connect. If you check the anatomy, then are inside the bobby, right? The side and the where the milk they come, right? Where they produce the milk, they store the milk, and when the milk ready, they travel to that rope where they call the duct, where they come out na the nipple, right? And then side and night, very, very common, especially women the way they get cancer na yana salon is very, very common. So that's not the most common cancer for the woman them, and it can be very aggressive, especially where it begins say invasive. Invasive means it invade the other tissues them are surrounding. It continue for invade, then a spread until it go far and destroy the body. That's not the aim of the cancer. The other cancers back then, they like ductal carcinoma, and the other one they call Pickett disease. Then at the bobby mots, na the nipple area, we can crash, we can peel, we can get sore, you know, where they dry. All that in a sign says something is wrong. So anybody will notice that they, especially women them, they for report them as soon as possible.
Alright, so with now some of the challenges them we on the face and battle with, especially for raise the awareness of breast cancer and asylum.
Now funding, obviously funding is needed, for go na that area for able buy the gadgets that we necessary for do the screening, for we necessary for raise the awareness, for sensitize the general public. Money funding are the main obstacle them where they affect, especially in the foundation when I think keeping breast cancer foundations. Now make we they encourage for partnerships and sponsorships them, right? Because really they take much, but all the sponsorships can help save a life, can help change a life. You can imagine a mama when a breadwinner of a family, it gets cancer, and you get picking the way they feed, where they school them. Most of them they still the school, secondary schools and colleges them. This not a real story where I did tell you actually, and in die and then picking them, they just left to themselves, right? They no get better care again, they no get that mother figure, so then really can affect them in a very negative way. You can imagine some can even drop out for make ends meet na the home and the family, so it can very terrible really, unfortunately. And imagine a picking a loss in mama, when a mama na a whole world, right? And this disease they affects so many women, even young women them, more especially women them in their 30s, according to the data where we get na Connaught Hospital. Women they were there in their 30s now, they more can affect and then more can die of the disease, right? So that means say not only the young age, not only the old age, but even the middle age women them, the youths can get affected of this disease. So we now make more, we need for pay attention to the body health.
So what are some of the preventive measures then we people would take for help, not for tap breast cancer?
Well, it's very simple. The number one, obviously, where everybody can put or can make control of, now for do the body checkup, right? For do themself the young body checkup, and for go to the sabi man doctors them or nurse where you go able check, because where you go to sabi man doctors them or nurse, then understand and they get training and experience for able detect problem na the body, as compared to a nurse or doctor we no get the experience, right? They need for go every 3 months, ideally every 3 months in the year, and that means say 4 times inside a year they for go na hospital. So not every month they go, but every month they need for go to check them body. Obviously you just look at the risk factors them, the things that where they cause the cancer, where they put person at risk for cancer, and try for avoid them. Unfortunately, some you're not able to avoid them. Like if you be a woman, you're not able to change that. If you're not able to change the fact that you the age, you they grow old, you're not able to change that thing. But the ones that were there in your control, for example, like the food way they eat, it's more healthy food, vegetables and fruit. And boko of local food, then they're very, very healthy. I mentioned that before, and that one of the most healthy chop way in a salon, na lafidi. Very healthy, yes, super healthy, because it gets a lot of food nutrients than way we get. We talk about pemaun and potato leaf, crane, all them green leafy food, and they're very, very healthy. But again, people can make them unhealthy. How? Where like say potato leaf, we they overcook them. The green potato leaf now they turn black potato leaf, and enough for be so, because you don't overcook them, you don't kill all the good things that the body need, right? Other thing back where the person they exercise, right? That make we encourage people then for joining for marathon racing, right? For go exercise regularly, go on a beach exercise, or do your own exercise now yourself, right? For able sweats, and if you get big body, for try for workouts for reduce the weight, because too much weight is not fine. And you need for stop for smoke tobacco, cigarette. Not only in that, if tobacco they inside shisha, you for avoid them as well. Even snuff stuff, where we all mammy and all party snuff, all that in a tobacco, and it can put person at risk, right? So it's very important for avoid that there. And also for stop for drink alcohol, then a beer for left for drink them, because totally yes, it's very advisable, because even the health professionals and the scientists they tell me that avoid for drink alcohol, beer, because it no gets no health benefits na the body, it just gets any only negative effects now we health or not to well body. So avoid that day, and more especially also you for avoid the environment where go put you at risk for get body cancer. we environments back can play a role for affect we even with personal products the way we they use, right? So we need for educate ourselves on that, be aware on that, and avoid them. And lastly, I forget to mention that, but misuse of these contraceptives when I like this family planning. It can be the tablets, it can be the pills, it can be the Captain Band, or it can be the injection. You need to be very, very mindful how you use them, because all in medicine, the other contraceptive, it gets an instruction on how to use them. But Bokuma na the misuse, where they misuse them, now can put them at risk for get cancer. Recent study don't come out say, just recently, as in about a month or two ago, they don't class contraceptives as a class 1 carcinogen. Class 1. That means that they cause cancer in the short long run. Yes. So unfortunately, their information then now they become exposed now to the general public, for many public become aware, because cancer don't they this so much. And some people can ask, why cancer not in the past as compared to the present? Now because of this generation and lifestyle, right? In the past, with grandma and grandpa, they be eat healthy foods, then they be the exercise. You see some old party and old man, they still strong, they work out, right? As compared to some young people, then by the time they don't 50 or 60, they don't begin, they become very wither and old, right? And so, and the lifestyle where they may get started, not the same thing like nowadays. So that can be because of the way they come with the industrialization and the way of lifestyle, basically.
So far, you now one pound the survivor them of breast cancer, and when it comes to them particular thing there, most people can shy away from them. People away, you notice, say, okay, they don't get cancer or breast cancer or whatsoever. How best possible for overcome stigmatization when it comes to breast cancer?
It is sad that now Salon or African people they will become stigmatized, but then they change self, right? Because people they think say we person get cancer now a death sentence, they can't die. And really we're not gonna blame them people and when they talk to cancer patients them, right? Because sometimes they don't even know what to say. Most times they're scared or they're very nervous, they don't know what to say to them patients them. I don't know if you can notice like how you can feel if person they can't die. How you going to communicate with them? You go become confused. You could be lost with words, right? So I'm not gonna blame them, but I advise that if you sabi person will get cancer, give words of encouragement and praise, right? And try and help as much as you can, especially the family members of that cancer patient. Imagine if now Kumbra we be they take a picking go school and now we get this sick, you know go get time for make lunch for them picking, you know go get time for taking them picking in their school. Then simple acts of kindness, you can say, okay, Carla, I'll take this picking in our school for you today, or I'll make lunch for them today, or I'll, release some of their burden on them, because the cancer patients in the battle cancer and a big battle, go able, divide a time and energy for do all the other things. Then sometimes you go to send chop for them, send sunakati for them or chop for them, deliver chop for them. Then they all are simple acts of kindness, right? Offer words of encouragement, even if you don't know what to say, just say, it's a there for you. If you need anything, just call me or ask me. Then they really go get a very, very good and positive impact on the cancer patient of itself. Because normally when they can get sick of this cancer, they can feel alone. Sometimes they can even become isolated by the family members, unfortunately. And then they make the situation worse. In my case, I be so fortunate that, thank God, I be get my family members where they're very supportive. My sisters, they try their level best for make and maintain me normal life, go out shopping, go to beach, go get ice cream, go exercise, now host with the with the chat, with the dance, and let we go engage in other activities where I didn't do. And I get Keeping Breast Cancer Foundation, we did it for me. We help educate me and my family about this sick, where they able guide me through my treatment options, and in top of that they even help for raise money for sponsor me treatments them for go overseas forget when I Ghana. And I'm so grateful for that, and that can make a whole difference, because I be able to catch me cancer in early stage. The fact that I be aware for check me Bobby regularly, I able catch me cancer when I stage 1, and that make a day alive till today, I believe, through the grace of God. So I'd encourage all say Bobby cancer not to death sentence, especially when you catch them early. And the more reason why you for check your Bobby regularly, because when they check your Bobby, you're able to catch cancer. I not say people no go get cancer, but I believe say way they check your Bobby regularly and you're able to detect them quick, believe in me, you no go die of cancer.
Alright, well, we the time for a wrap up now. The program so far. Khadija, waiting could be your message to family we did this but quickly. This just crossed my mind. Breast cancer, it transfer from one person to another?
Well, only if you inherit them through your gene, your DNA from your parents, yes. But like if person get cancer and a hug, a share food, or a touch person when not get cancer, you know they transfer. No studies, no evidence they transfer at all. But it's possible like if you born a family we get a cancer, now the family chances for make you get the gene where you don't inherit, then they can be high.
So for instance, for the man them we like let's say for suck Bobby and all, then in that period you suck somebody in breast we get breast cancer, then that liquid they enter, is it transferable?
It depended if the liquid come itself in the first place. But no, we're not getting such evidence of such, okay? I don't believe so. And cancer now something where they spread, yes. However, it no can spread that kind of way, right? It only they spread through genetics, yes.
Alright, so with the wrap up now, and this now the closing of the month of October, where now the awareness in the next let's say 5 years from now, what do you expect, or how best do you think say Thinking Pink Breast Cancer Awareness Foundation could day when it comes to the awareness of breast cancer, and how best you think say, well, if not eradicate all, but at least minimize the high rate of breast cancer for women and men?
Wow, but could they still for do? Although we come off far, with regards to treatment, 5 years ago, now just 5 years ago, we begin the give chemotherapy in the country. Okay. Now just 5 years ago, where we able get sponsorship, we able train 10 doctors and nurses for get specialized training in the area of cancer care. Right? So now just 5 years ago. So I believe that the next 5 years something big can for happen, really. I believe so. But still Thinking Pink Breast Cancer Foundation alongside with a partners them, we continue for raise awareness. We continue for make noise, especially so that the lawmakers or decision makers them could able establish we own cancer control policy, because they like today salon no get cancer control policy, and this now a policy we go able help for able provide proper treatment options na salon na ya. We go able get accessibility to all and treatments them na salon na ya. But unfortunately we still get a long way for go. So we continue for advocates state level, international level, for more treatment opportunities for cancer patients them na this country, because salon people them na salon get them. Now we don't get them, so we got for treats we young people them. It can very be saddening for somebody we sick. Imagine possibly sick for come near a home, in near a family members them, go to another man country, sometimes alone, to a place where they no understand the language, like the food, eat the food, and it can be very even expensive because they get something where they call price discrimination. Let me say, for example, Ghana, a perfect example, right? A Ghanaian can pay only 100 Ghana cedis for a treatment, but where another person come out other country go there, they pay 500 Ghana cedis. That is price discriminations, and that can be because now other person country, the Ghanaians, if they want also take care of their young people them, right? Why salon not for do that also? Why salon not forget that also? That are the questions where we pose to the lawmakers and the Ministry of Health, more especially. Why salon not forget we own cancer treatment facilities? Why always we need for run to other people country for get them treatments them, especially where we able afford them and we able attain them? Why? Because Bokuma them they die. Just last week we get 3 deaths of cancer case them. 3. And every week we get like 5 or more deaths then they happen. Why if it be so?
Well,
so my message
to the general
public now for be breast aware, know your and understand you bobby, check you bobby regularly, go for checkup, because you go able save your life. But woman they wait on the sick now, where they not in deathbed, they can tell you say if I been no. If I be no for check me bobby, if I be no about these things them. And they're not can fortunate really enough for know about this breast cancer, especially the time then when they detect them. It can be normally too late. But you where they watch, you where they listen, you know. And not only be selfish with this information, share with your family and friends. Because I know of a mother who gets sick of this disease, bobby cancer, it hide them from it picking them. It hide them from a family members them. It end up for die. But one by one, if family members they did also detect bobby sick na bobby. Imagine if that woman be don't share this news to them, educate them, they go able detect them early, and they no go able get sick at this stage now within day. Some of them they already don't cut them bobby, because they no be get the awareness, because